The flu has claimed its first death in Delaware, and meet the woman behind brouhaha. This is the Delaware Way. Hi, I'm Larry Menti. Welcome to the Delaware Way. It is flu season, and the flu season has arrived in Delaware with some tragic news. Dr. Karyl Rattay is the Delaware Director of Public Health, and Doctor, you've had your first death.
Yes, unfortunately, we've had some sad news over the past week that our first influenza death did take place here in Delaware.
And it's horrible for the person involved and their family. It's an important reminder for all of us.
It is. I mean, many people, approximately 36,000 people die in the United States every year, unfortunately, from influenza. So it's a nuisance to many people, but unfortunately, there are a number of people who are hospitalized and individuals who die from influenza every year.
I remember we had you in a few weeks ago. We were talking about Ebola, and even at that time, we were saying that there's going to be a whole lot more people who are dying of the flu. It's just not getting as much publicity. How do you get people to understand that this, because I think we're used to the flu, that is part of the problem, that this is far more dangerous than some of the other things we've dealt with?
Yeah, well, you know, we try to remind people every year that influenza is real. It's out there. We are seeing plenty of infections in Delaware and all three of our counties at this point in time.
But people don't see it as a killer.
They don't. It's true. They don't. And but it is. And some of the reminders that we give to people that hopefully will help some people think about preventing influenza for themselves or their family members is, you know, if you're not worried about yourself, think about the importance of protecting the loved ones around you that are at higher risk. So there are certain groups of individuals that are at higher risk for those more serious consequences like hospitalization or death, and that would include older individuals, individuals with chronic conditions, especially if somebody has multiple chronic conditions. Pregnant women can have a very difficult time with influenza, and also younger children. So you know, most people are around somebody in those high risk category if they are not high risk themselves. And so, you know, we try to remind people that, you know, you can spread this disease to your loved ones, and it's important to help protect them.
I heard somebody who came, speaking of the Ebola thing, I heard a nurse that had come back and was being interviewed on one of the national news, and they were talking about the Ebola handshake, where people were going up and not shaking hands and going like this. And then she said something that was striking. She said, you know, this isn't just Ebola. She said, you know how many diseases we could prevent if people just didn't shake hands? And I know that's not going to stop in this country, but washing your hands is probably a big part of not getting the flu.
Absolutely. Second to the flu vaccine itself, it is our second best defense against influenza. And of course, all the other infections that are out there right now, and there are a variety of different viruses that are out there at this time of the year. So hand washing or using hand sanitizer is a great thing to do. I mean, just placing it strategically in different places where you spend time can really help a lot. Also, you know, really important if you cough or sneeze to do it inside your arm, your inner arm, so that you're not spreading germs. And then
I learned that from my kids. They're teaching that in the grade schools now, and they came home, and because I was always taught to do it in the hand. And so, but you were going to say something else, another prevention method.
Yeah, another important prevention message is when somebody's sick, stay home. So if you have a colleague who's coughing all over you at work, or especially if somebody who has a fever, you know, it's good to gently remind them to stay home.
Yeah, you got to tell the bosses that. You got to tell the employers that. No, I'm very serious, because a lot of people insist on somebody to coming into work when they're sick, and it's probably the worst thing you can do for your business, because it's going to hurt your productivity in the long run when all of the rest of your office is out sick. That's going to go right through the office. The flu vaccine, is there enough of it this year? They've had problems in the past.
Yeah, there's adequate amounts of the flu vaccine this year, so shortage is not a problem. The other thing that is great is these days it's so accessible because it's available in supermarkets and pharmacies, and of course most healthcare providers, especially primary care, have it available. And for those who are unable to afford it, public health clinics make it available as well to people.
Is there anybody who should not be getting the flu vaccine?
It is recommended for everybody over the age of 6 months, and we only don't recommend it for those who are infants because it's not yet available for them. But everybody over the age of 6 months should be getting the flu vaccine.
Doctor, thank you so much for coming in. I really appreciate it. Dr. Karyl Rattay, the Delaware Director of the Public Health Division. Thank you so much.
Thank you very much.
When we come back, it's that time of year again when the food bank needs food. As a matter of fact, we have somebody here that's going to tell you they need food all year long, not just this time of year. When we come right back.